The importance of catching cancer in its early stages cannot be overstated. Early detection is often the key to successful treatment and can make the difference between life and death. Yet many seniors dismiss potential warning signs, attributing them to the natural aging process. This misunderstanding can lead to dangerous delays in seeking medical attention. By the time symptoms become severe enough to demand attention, cancer may have progressed to an advanced stage, limiting treatment options and lowering survival chances. For this reason, it is essential to understand the early warning signs of cancer and take immediate action when they appear. The body often gives subtle hints when something isn't right, but recognizing these signs requires a combination of awareness, education, and vigilance. For example, weight loss, chronic fatigue, or even persistent pain are often brushed off as normal parts of getting older. However, these symptoms could be indicative of an underlying issue that warrants further investigation. Many seniors, unfortunately, avoid seeing a doctor until their discomfort becomes unbearable, which can sometimes be too late for early intervention. The goal is to catch cancer when it's most treatable, and this is only possible if you know what to look for and take any signs seriously. Consider a powerful example of how awareness can save lives. Take the story of Clara, a 68-year-old grandmother who felt unusually tired and noticed some changes in her bowel habits. Initially, she thought these changes were due to her age, but a health talk at her senior center encouraged her to see her doctor. Clara's decision to act quickly led to the discovery of colon cancer in its early stage. After undergoing treatment, she made a full recovery and now advocates for early detection among her peers. Stories like Clara's serve as reminders that vigilance and prompt action can truly save lives. Research shows that early detection can dramatically improve survival rates for most types of cancer. For instance, when caught early, the 5-year survival rate for breast cancer is about 99%, but this drops significantly when the disease is detected later. Similarly, prostate cancer has a nearly 100% survival rate when found early, but becomes much more dangerous in advanced stages. These statistics highlight the critical role of awareness and early action in improving outcomes. Understanding this can empower seniors to take charge of their health and pay closer attention to their bodies. Many people hesitate to bring up minor symptoms with their doctors, fearing they might be overreacting. But when it comes to cancer, there's no such thing as being too cautious. Doctors encourage patients to report any unusual or persistent symptoms because catching cancer early gives the best chance for effective treatment. Whether it's an unexplained lump, changes in bowel habits, or prolonged fatigue, these symptoms should never be ignored or brushed off. It's better to have a false alarm than to miss the opportunity for early detection. The conversation around cancer doesn't have to be one of fear. It can be one of empowerment and proactivity. By educating yourself on the early warning signs and making a commitment to act on them, you can take control of your health. Prevention begins with awareness, and this starts with being informed about what to look for. When paired with regular medical checkups, this knowledge forms a powerful defense against cancer. The reality is that many cancer symptoms can overlap with other common health conditions, which is why vigilance and follow-through are so important. If you feel something isn't right with your body, trust your instincts and seek medical advice. Even minor symptoms that seem insignificant could hold the key to catching cancer before it has a chance to spread. By being proactive, you increase your chances of detecting cancer early, when treatment is most effective and recovery is most likely. Understanding the importance of early detection isn't just about statistics. It's about giving yourself the best possible chance to live a healthy, fulfilling life. Cancer may be a daunting word, but it's also a challenge that can often be overcome with the right approach. Knowledge, awareness, and prompt action are the tools that seniors need to protect their health and ensure they catch cancer early. These tools can save lives, and they start with understanding the critical role of early detection. There are 8 early signs of cancer that everyone, especially seniors, should be aware of. These signs often appear subtly and may be mistaken for less serious conditions or dismissed as normal aging. However, being vigilant and recognizing these symptoms can make a critical difference in catching cancer early, when it is most treatable. One of the first signs to watch for is unexplained weight loss. Losing 10 pounds or more without trying might seem like a welcome change to some, but it can be an early indicator of cancers like pancreatic, stomach, or lung cancer. This type of weight loss occurs because cancer can alter the way the body processes food, or because the body is using more energy to fight the disease. If you notice a significant drop in your weight without changes in diet or activity levels, it's time to see a doctor. Persistent fatigue is another common symptom that's often overlooked. While it's normal to feel tired occasionally, chronic fatigue that doesn't improve with rest might signal cancers like leukemia or colon cancer. This kind of fatigue is different from the tiredness that comes after a long day. It's an overwhelming exhaustion that makes daily activities feel nearly impossible. If you find yourself constantly drained for no clear reason, it's worth investigating further. Changes in the skin can also be an important early warning sign. This includes new moles, changes in the shape, size, or color of existing moles, or unusual discoloration of the skin. These changes could be a sign of melanoma, one of the most dangerous forms of skin cancer. Skin that appears unusually red, yellow, or darkened can also indicate other types of cancer affecting internal organs. Regularly checking your skin and reporting any abnormalities to your doctor is a simple but vital step in early detection. A chronic cough or hoarseness lasting more than 3 weeks is another red flag, especially if you're not dealing with a cold or allergies. Persistent coughing can be a symptom of lung cancer, while hoarseness might indicate throat or laryngeal cancer. If you notice blood when coughing, this symptom becomes even more urgent and should be addressed by a medical professional immediately. Unusual bleeding or discharge is another symptom that should never be ignored. Blood in your stool or urine can be an indicator of colon or bladder cancer. Similarly, coughing up blood or experiencing abnormal vaginal bleeding could point to cancers of the respiratory or reproductive systems. These signs often indicate that something serious is happening in the body and warrant immediate attention. Lumps or swellings are among the most commonly known cancer symptoms, but they are often disregarded when they don't cause pain. However, any unexplained lump, whether in the breast, neck, abdomen, or elsewhere, should be evaluated by a doctor. Many cancers can present as painless masses in their early stages, making it crucial to check your body regularly and report any changes. Persistent pain in the back, stomach, or joints is another symptom to take seriously. While aging often comes with aches and pains, consistent discomfort that doesn't respond to usual treatments could be a sign of cancer. For example, back pain can be associated with cancers like pancreatic cancer or ovarian cancer, while joint pain may be linked to bone cancers. Lastly, changes in bowel or bladder habits should raise concern. If you experience prolonged constipation, diarrhea, or frequent urination without an obvious cause, it could indicate colon, bladder, or prostate cancer. Sudden difficulty in passing stool or urine is especially concerning and should be addressed as soon as possible. These 8 signs, unexplained weight loss, persistent fatigue, changes in the skin, chronic cough or hoarseness, unusual bleeding or discharge, lumps or swellings, persistent pain, and changes in bowel or bladder habits, are not definitive proof of cancer, but they are signals that something in the body isn't functioning as it should. Recognizing these signs and acting quickly can lead to earlier diagnosis and significantly better outcomes. The key is to stay alert, trust your instincts, and consult your doctor if anything feels unusual or persists for more than 2 weeks. Taking proactive steps to prevent cancer and ensure early detection is a crucial part of maintaining health, especially in later years. By incorporating regular checkups, screenings, and healthy lifestyle habits into your routine, you can reduce the risk of serious complications and increase the chances of catching any issues early. These actions not only protect your health, but also empower you to take control of your well-being. One of the most effective ways to stay ahead of potential health concerns is to schedule regular medical checkups and screenings. For seniors, tests like mammograms, colonoscopies, PSA, prostate-specific antigen tests, and skin exams are essential tools in identifying cancer in its early stages. These screenings can detect abnormalities before symptoms even appear, providing a crucial opportunity for early intervention. Additionally, routine blood tests and physical exams allow doctors to monitor your overall health and address any concerns promptly. Beyond screenings, maintaining a lifestyle that promotes cancer prevention is equally important. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins provides the nutrients your body needs to function optimally. Antioxidants found in foods like berries, leafy greens, and nuts help protect cells from damage, reducing the risk of cancer. Avoiding processed foods, excessive sugar, and unhealthy fats also plays a role in lowering cancer risks. Regular physical activity is another cornerstone of cancer prevention. Exercise helps regulate body weight, improves circulation, and reduces inflammation, all of which contribute to a lower risk of developing cancer. You don't need to engage in strenuous workouts. Activities like walking, swimming, or yoga are excellent options that promote both physical and mental health. Equally important is the need to avoid harmful substances like tobacco and excessive alcohol. Smoking is a leading cause of various cancers, including lung, throat, and bladder cancer, while excessive alcohol consumption increases the risk of cancers such as liver, breast, and colorectal. If you currently smoke or consume alcohol in excess, seeking support to quit or reduce intake can significantly improve your long-term health. Being in tune with your body is a vital part of taking action. Pay close attention to any changes or symptoms, no matter how small they may seem. If you notice persistent fatigue, unusual lumps, unexplained weight loss, or any of the other warning signs discussed earlier, don't hesitate to consult a doctor. Acting quickly is often the difference between a treatable condition and a more advanced stage of illness. Trust your instincts. Your health is worth the effort and attention. Taking these steps not only protects your health, but also offers peace of mind. By staying proactive, you reduce the anxiety that often accompanies uncertainty about your well-being. Regular checkups, healthy habits, and vigilance empower you to face the future with confidence, knowing you are doing everything possible to safeguard your health. In conclusion, the power of prevention and early detection cannot be overstated. Cancer may be a daunting subject, but with awareness, regular screenings, and a commitment to healthy living, it's possible to minimize risks and improve outcomes. By prioritizing your health today, you set the foundation for a longer, healthier, and more fulfilling life. It's never too late to take charge of your well-being. Your future self will thank you.